Medical professionals of Reddit, when did you have to tell a patient I've seen it all before to comfort them, but really you had never seen something so bad, or of that nature? As a medical student doing my first placement in the emergency department, I was waiting outside the triage room to ask the nurse something. I was the lowest ranking, most clueless person in the department. I knew a lot about the Krebs cycle, not a whole lot about, medicine. A young man came up to me and said he was sorry to disturb me. He just wanted to check. It was just, well, not to queue jump or anything, but he wanted to check. Can this definitely wait for triage? He then unwrapped a towel from his hand and showed me his thumb, which he had dropped a loaded barbell onto. It was shattered, just flattened, with splinters of bone coming out. I stared at it. He stared at it. I stared at it. Then I told him, oh yes, no problem at all. He'd better take a seat and I'd make sure someone was with him right away. Genital warts the size of grapes on the guy's D. Quoth he. The ladies never complain. Posted this before. 4th year med student here. On my ER rotation a couple months back, I walked into the ED and was immediately asked to help a nurse and resident put a catheter in a patient. Now a catheter placement is usually a one-person job, so I was pretty confused as to why they needed my help. I walk into the patient room, and I'm immediately greeted by a disgusting rotting flesh smell. Worst thing I've smelled in my life. The patient is to be pushing 400 pounds and has the worst edema, soft tissue swelling, from congestive heart failure I've ever seen. His scrotum and D foreskin are about the size of a small watermelon, and the foreskin had swollen completely over the tip of his D. The nurse had a speculum, tool OBGYNs used to look inside V's, inserted into the man's foreskin while the resident took the catheter in a hemostat, pliers type thing, and jammed it into the man's pee hole for 20 minutes. They finally got the catheter in and took the speculum out. It was covered in a thick brown discharge that looked like fermented pissit. I still don't know how he let his scrotum and D swell that much. Edit. We comforted the patient the whole time and kept telling him we had done it like this before. Total lie. No one in the ED had ever done or seen anything like it. Had a guy that shot himself under the chin with a shotgun. He had actually done it like 16 hours prior to family finding him. He was still alive, conscious and alert to what was going on. His jaw looked like Predator. I had family freaking out, of course. Had to tell them we see worse often, which may be true, but they are usually dead. He lived for almost a day after shooting himself, then died in the back of my ambulance. Lady came in with possible stroke symptoms, numbness, weakness, difficulty speaking, Gale abnormalities, CT brain unremarkable. Lab work was really odd. We were thinking cancer, so we decided to CT her chest and abdomen as well. Turns out she had a dissection the entire length of her abdominal aorta and going into her right femoral artery. Left femoral had an aneurysm and was beginning to dissect as well. She had formed a massive clot throughout her abdomen that was miraculously keeping her alive. Basically all of her organs were ischemic, dead. About 5 different teams showed up in the ER to see her. After hours of discussion, the consensus was that there wasn't a damn thing anyone could do. We sent her to hospice. Edit. Li5 in a comment below. Please don't give me any more gold or silver. Take that money and make a donation. If you don't know where to donate, consider American Foundation for Suicide Prevention. Years ago my then 11-year-old shattered both femurs and her hip. At the time, her orthopedic specialist was so reassuring and confident that we had no doubt about her recovery. A year later, we went back for a review and he asked me if I'd like to see her trauma x-rays. Not having any idea of the reality, I said yes. What I saw looked like her leg bones had exploded. After my freaked out reaction, I commented on how cool and calm he was, and how certain that she'd be fine. He said he'd actually had to go for a short walk around the hospital to collect his thoughts since he had no idea how he would put this child back together. He also told me he'd used the films as a teaching aid. He's one of my heroes. I work in gynecology and I had to chaperone a male doctor for a pelvic exam. Patient was complaining of pain and discharge. A veal area was completely red and swollen. He then so gently inserted the speculum to get a look and immediate white cottage cheese like substance comes pouring out onto his lap and hits the floor. Imagine dropping a container of cottage cheese on the floor. We stare in disbelief. He then had to remove the speculum and use it like a spoon to scoop out more discharge just so he could get a look inside. He tells her it's a yeast infection and she'll be good in no time with the prescription medicine. That day I learned if you smile while humming it helps in suppressing your gag reflex. Edit. Thanks for the silvers. Edit 2. Gold. Thanks so much. In 2011 I had a saddle pulmonary embolism 2 weeks before my scheduled wedding. My quite seasoned heart surgeon seemed pretty confident that I'd be okay, and he even said he'd get me to my wedding on time. Long story short, I was in the hospital for about a month due to complications. Several weeks later, when I was visiting my heart surgeon for a follow-up, he told me he'd only ever seen 2 other people as sick as I was. Those 2 didn't survive. Paramedic here. Had a homeless guy call saying he stepped on a nail about a year ago. I could smell it from the door so I expected it to be bad. But when I went to pick up the leg by his heel there was just nothing there. His foot just evaporated into pus and maggots and his metatarsals clinked through my fingers. While I'm standing there trying to comprehend what happened he just sighed and asked me to pick up his foot. What foot, buddy? Put it back on. He said it falls off a lot these days. But it still hurts so that's good, right? I had no clue what to tell him. Nurses thought it was hilarious that the baby medic, that's me BTW, got grossed out. Edit. Yay, my gold cherry has been popped. I'm a baby medic no longer. At least on Reddit. Had a patient who needed a lower G study to fix a bowel bleed. To get a study done you need to poop clear mucus. 3 days we bowel prepped with heavy laxatives and enemas. He barely pooped anything. He put on the call light at 6:45. 15 minutes before my shift ends. He calmly says, I kinda want to try and poop. He said it so casually I figured he was going to toot out another gas bubble and walk back. He stood from the bed, took 1 step, and the floodgates burst. 3+ days of the most rancid liquid stool I had ever encountered. Just wouldn't stop. He left a river of stool from the bed to the bathroom, coated the walls as he bent to park his butt on the toilet, and continued to dump out 7 people worth of poop. In my 9 years I have never seen that much come out of a person. He was not a large man. He was so embarrassed but I just kept my face as solid as possible, grabbed half the linen closet and 3 packages of Cavi wipes, and sopped it up. Told him this happens all the time. Edit. Thanks for my first gold. Edit to my edit. Thanks for my first platinum and all the kind words. I love what I do. Nursing corrections here. Had an inmate patient come in with complaints about severe lower abdominal pain. He told me that he had something stuck in his prison pocket. Before I could ask him what he stuck up his anus, he bends over and shows me a cord sticking out. I told him, don't trip. I'm sure the doctor can help you out with that. You'll be alright. Come to find out, the prong of the phone charger got caught up into something and it was stuck. As I was trying to comfort him, I started to hear this vibrating sound. So I asked him if he heard it do. He said, it's the phone inside me that stuck with the charger. It wasn't just a regular flip phone. It was one of those Samsung smartphones. When I was a med student on the trauma service, there was a gentleman who decided to attempt suicide using a shotgun aimed at his heart. Unfortunately, the first thing that comes out of a shotgun when it is fired is a gust of air, which changed where the gun barrel was pointed when the shot came out. The shot pellets ended up hitting everything but his heart, lungs, ribs, spleen, stomach, liver, pancreas, and large and small intestines. In the OR, the attending surgeon told me to put my hand on his beating heart because that will likely be the only time in my medical career that I would touch a beating heart. I did. It was cool. In case anyone reads this in a thread with 1,500 plus posts. He survived, though. He was on the trauma service for the entire month I was there, and was in the hospital for a long time further. Lots of stories, many already covered by others. I will share this particular story with my legs crossed. Motorcyclist came in after someone left turned without checking. He had gone over the hood, slid and somehow somersaulted landing on his ass sitting up. He slid across intersection mostly on his ass, getting serious road rash. Luckily he was only a block from hospital and ambulance. They pack him and bring him to the ER. We end up cutting off his chaps and jeans and begin the cleanup of gravel and sand embedded in his thighs and ass when all of a sudden, his testicles fall out of his scrotum. He had basically sandpapered a hole in his scrotum while skidding on his ass. The attending pauses, grabs the saline, irrigates scrotum and nuts, fondles them back into place while humming. I handed him some gauze to pack the wound and smiled at the patient who was under a local. Then I went on break, went fetal and dry heaved. Edit. Thank you for my first gold. I used to do psychiatric evaluations in an emergency room setting. One time, I'm evaluating this 60-year-old woman who is lying in the hospital bed. I'm asking her questions, and she stops me and says, "Excuse me, but I need to pass some gas." I let her know that this is a medical setting and that is a completely normal body function and not to be embarrassed. People pass gas all the time. I was not prepared for what came next. She let it rip, and out came the loudest, wettest, and longest sounding fart I have ever heard. It was bubbly and juicy, hitting all the deep notes while ending on a squeaker. I don't think Satan could have made a noise like that with his anus. It sounded so relieving. But then the smell hit me. It was bad enough that I started to gag and had to excuse myself from the room. When I came back I politely asked if she needed a nurse for anything in case she needed to be cleaned up after that, but she declined. Obviously I've witnessed people farting before, but I've never heard or smelled anything like that before. That was something else. I had to have my leg rebuilt after a car accident and was eventually sent to Duke University for my surgery. My surgeon was supposed to be like the best orthopedic surgeon in the country. I think he used to work for the Baltimore Ravens. Anyway, all the doctors from my hospital at home were very unsure if I would even have a functioning leg, let alone walk normal again. The first appointment at Duke, that dude told me it was really not a big deal and he would have me fixed almost good as new. I honestly thought he was just trying to be nice and optimistic, but he was very serious. 5 months later I was walking and learning how to run again. He said I was one of the most complicated surgeries he has had to do and a group of surgeons flew in to observe him do it. Not a medical professional, but my mom is an RN. And boy has she had some stories over the years. Yet, one in particular stands out. She had a male patient come in with a hem. Extremely swollen D. Like, the size of a Pringle can swollen. She said it was the biggest D she ever encountered in her decades as a nurse. He claimed he broke it during sex. She had to put a catheter in. The guy was freaking out and she had to reassure him that this was a walk in the park for her. But she was seriously questioning how to get the catheter in. She called in her co-worker to help steady his D. Well, also so someone else could just witness what she was seeing, while she gave him every painkiller she was legally able to give, and stuck the catheter in. Got it in the first try. Thankfully, she still doesn't know how she managed to get it in, but was thankful she did, lol. Eventually it came out that he hadn't broken his D during sex but actually masturbated after cleaning his fish tank without washing his hands and got an infection from it. A little late to the part, not the worst. But I had a patient once with a stomach bleed and a small bowel obstruction. He had to put in an NG tube that goes in your nose and down to your stomach, to decompress his stomach, which was pretty distended and hard. I'm inserting the tube and as soon as it hits this guy's gag reflex he projectile vomits and sprays very dark, half digested blood all over himself, the bed, the wall, and the floor. It's basically a scene from The Exorcist. I had to dive out of the way and somehow was unscathed. He couldn't stop for almost 10 minutes as we're trying to get this thing down to where it needs to go. Finally finish placement and it immediately suctions out 3 liters of this black sludge that is old, digested blood. PT was mortified and we had to play it off like, oh no it's fine. It's really common to vomit during the procedure. We'll just go get some towels and clean you up. My co-worker and I left the room and just stared at each other in silent shock. I'm the patient here and the nurses didn't even try to say they had seen it before, but it still fits. When I was getting treated for cancer I got a really bad case of pneumonia and had to be intubated and put into like a semi-coma type deal. I don't remember anything that happened in those 6 days, but I was apparently made sober enough to open my eyes for visitors every day, so I don't know if that counts as a coma. It was some pretty serious pneumonia because it was like less than 2 days between my first cough and them making the call that I would need to be intubated to stop me from drowning in my own fluids. So they didn't mess around and gave me a ton of antibiotics. You know how some hospital beds have a track along the ceiling that they can hang IV bags from? I had enough antibiotics hanging from mine that it broke and fell to the floor. Again, no memory of this. But the thing that was truly unprecedented occurred when they were changing out my butt bag. I don't fully understand what it was, but they had something on or under my butt that collected all my bowel movements. They put it on after I was heavily sedated and removed it before I was totally awake, so I don't really remember it. For anyone who doesn't know, antibiotics can cause a lot of diarrhea. Apparently when they rolled me on my side that day, I let loose a fire hose of liquid that arched through the air across the room and splattered all over the door and window, which were about 12 feet away from my bed. I think it's super cool and funny, so they didn't have to pretend like it was normal to comfort me. Edit. WOOO. New most upvoted comment.